Nurse John here. This is not medical advice and is no substitute for emergency care or conversations with your doctor. This is only my flawed understanding. Nurse John here. I just wanted to talk about something that we memorize, but we really don't use it enough in order to understand it, or at least I don't. And that's blood pH. Just wanted to talk about why it matters, how the body keeps it stable, and kind of a little discussion of what the labs mean. So let's just start with a definition of pH. The logarithm of the reciprocal of hydrogen ion concentration in gram atoms per liter. Now, that's useful to just about nobody. So we'll just call it a hydrogen scale, where the lower end of 1 is acidic, the middle is neutral, and the high end up to 14 is alkaline. So our body chemistry requires a really very tight range of 7.35 to 7.45, which is just slightly basic. Chemical reactions and enzymes in the body need to be in that normal range to work effectively. Even the ability of our blood to carry oxygen relies on being in that pH range. So, as everyone knows, our bodies make CO2, and CO2 dissolves in our blood, which is basically a water solution. So CO2 mixes with the water, forms carbonic acid, and then an enzyme in our blood breaks it apart into hydrogen ions, which are acidic, and bicarbonate, which is an alkaline. The body can also put those components back together to CO2 when that's needed. Bicarbonate is a buffer, which means that it helps resist changes in pH. So that would be the bicarbonate buffer system. It's kind of an interesting chemical because it can neutralize both acids and alkalines. That's a little atypical that it can do both of them. That's what makes it such a powerful buffer. Bicarbonate itself is an alkaline, so it helps offset the acidic components of CO2. Bicarbonate is one of the labs that's used to monitor body pH. The higher the bicarbonate level, the higher the pH. The lower the bicarbonate level, the lower the pH. So low bicarb is acidic, high bicarb is alkaline. Let's talk about kidneys. They're important in maintaining the pH of the blood too, because they filter out of the waste stream and retain most of the bicarbonate, which supports the body's ability to maintain a stable pH. Urine is usually somewhat acidic, but that can vary a little bit. So the kidneys excrete acids and retain bicarbonate, helping to keep the blood stable. So the kidneys are monitoring and adjusting pH over time, but it's a slow process. Can take hours or even days. The kidneys and bicarbonate levels are the metabolic pathway of pH regulation. So you have kidneys and then the lungs. The lungs are important in maintaining pH because they remove CO2, which has an acidic impact on blood. The brain is constantly monitoring pH and adjusting our respiratory rate to maintain that 7.35 to 7.45. So when we see our patients with fast or slow respirations, we are looking at a body that is changing its pH level. Now, whether the person is breathing fast because they're in pain, or they're breathing fast because their brain recognizes acidity, the effect's the same. When our respirations are slow or fast, we are adjusting pH. So increased breathing increases pH. Decreased breathing decreases pH. Whether that's what the body's goal is or not, that's what's happening. So that's the respiratory pathway, and it's much quicker than the metabolic pathway. It only takes minutes to make pH adjustments by changes in respiration. Let's talk for a second about another lab result, and that's anion gap. Thanks, Jess, for the conversation the other night. I really didn't understand this one very well. So what anion gap does is it looks at charged particles in the blood, and it looks at known charged particles like sodium, bicarb, CO2. And so what it does is subtracts one from the other and reveals some levels of unexpected acidity. So a high anion gap would indicate acidity like you might find with lactic acid or ketone acid. Kidney failures and poisons also could cause an elevated ion gap, indicating acidity. So the higher the ion gap, the more unknown acidity in the body, because we've accounted for the ones we know about, essentially. It's also worth noting that low albumin in a critically ill patient can artificially lower anion gap and mask acidic conditions. So another consideration, let's talk about pH in the digestive tract. Radically different than pH in the blood, but has a significant impact on the blood. So if you look at the digestive tract from the stomach to the colon, you see the stomach is very acidic and the colon is somewhat alkaline. Stomach being acidic so it can break apart food and kill pathogens. And then the pancreas and the intestines release bicarbonate, neutralizing that acid. And that's why when you get to the colon, you end up with an alkaline solution. So when you vomit, your body is losing acids at the stomach. And when you have diarrhea, your bodies are losing alkalines at the colon. So the loss of hydrogen ions from repeated emesis causes an increase in blood pH, and that would be metabolic alkalosis, which usually will trigger compensation by the brain seeing that change in pH and causing slow, shallow breathing. And sort of the opposite's true. When you have lots of diarrhea, you lose in bicarbonate out of your colon, causing a decrease in pH and metabolic acidosis, and your body would compensate by rapid deep breathing, getting rid of CO2. So yeah, that was it's just a quick video about pH, how your body's chemistry, lungs and kidneys work together to keep things stable. Just to note, this is the last time I'm going to put one of these nursing medical type videos on John's Outdoors in Maine, because I've launched a new channel just for these nursing healthcare topics. It's called Nurse John. You can find that at Nurse John 7. If you found this helpful, like, subscribe, and share it with another nurse who might appreciate it. Thanks for watching. See you on the new channel. Bye-bye.